Hello and welcome to Healthy Minutes, the program that talks about your health. I'm your host, Dr. Mo. Now, although the world was introduced to the Zika virus well back in the mid-20th century, the disease has been receiving much hype in the media lately. In fact, the World Health Organization declared it a public health emergency of international concern back in February of 2016, mainly due to associations with developmental abnormalities in babies born to affected mothers. But how serious is this disease and what risks do we face here in Bahrain? Public health consultant Dr. Wafa Al-Sharbati explains.
We are following developing health news at this hour. The usually cautious World Health Organization is now using alarming language to describe the Zika virus.
And back here at home, and a major health alert tonight, the Zika virus being spread by mosquitoes right here in the U.S.
The nation's top health officials warning that the Zika virus appears to be a lot scarier than first thought, spreading much faster.
I am now declaring that the recent cluster of microcephaly and other neurological abnormalities reported in Latin America, following a similar cluster of French Polynesia in 2014, constitutes a public health emergency of international concern.
Zika virus infection is a very mild disease, usually, and it usually has mild symptoms such as fever, headache, joint pain, body pain, muscle pain, and it is short-lived, like lasting for 2 to 7 days. And Zika virus infections and outbreaks have occurred in the past, but I think what brought the world's attention to this particular outbreak in 2015 is the association between Zika virus infection and microcephaly, which is a condition in which the baby is born with small head, as well as the association between the Zika virus infection and a very rare disease affecting the nervous system called the Guillain-Barré syndrome. This infection or this virus is usually transmitted through the bite of an infected mosquito and of a particular type of mosquitoes called Aedes mosquitoes. Sexual transmission is also possible, and we are currently investigating other types of transmission such as through blood transfusion. As I said, this is a very mild infection and a very mild disease, and there is no specific treatment for it. We just advise the patient to take plenty of water and to take enough rest. Perhaps some common medicines such as those used to treat fever and the body pain. And there is also no vaccine. And the key measure for protection against Zika virus infection is to protect against mosquito bites by using, and that's why we're asking and we're advising patients who are going to affected areas about wearing clothes that cover as much of the body as possible, using mosquito repellents, and as well as sleeping under mosquito tents. In Bahrain, the risk of Zika infection is extremely low because we don't have Aedes mosquitoes. And we're sure that we don't have Aedes mosquitoes because we have a strong mosquito surveillance system in which we study the distribution and the types of mosquitoes, and this is an ongoing system. So we are sure that we don't have Aedes mosquitoes. Hence, the risk of getting Zika infection locally is very low. We also conduct regularly mosquito control activities, targeting mainly mosquito breeding sites. In spite of this low risk, health officials in Bahrain, have taken all the necessary steps to monitor the situation very closely. So we strengthened the already existing mosquito surveillance system and control activities. We have also trained healthcare workers on proper identification and diagnosis of cases of Zika infection, especially among travelers returning back from affected areas. We have also equipped and trained our lab technicians on doing and conducting tests for Zika virus in Bahrain. And in Bahrain also we have mandatory reporting for microcephaly and Guillain-Barré syndrome. And that's why we're closely monitoring the occurrence and the incidence of these conditions. So even if we miss any case, we will not miss the communication.
You're watching Healthy Minutes with Dr. Mo.